you're not going to ask any questions, I'm going to ask you one. So I have material on the Center for Healthy Aging Research. I am the Joanne Leonard Endowed Chair, Endowed Director for that. And we have something called the Life Registry, where we encourage as many Oregonians as we can possibly get our hands on who are over the age of 50 to sign up and possibly participate in the research that we do on this campus. We've got 800 folks so far. We'd love to get another 200-300. So if you're interested, I have on the table outside both brochures for the center and little bookmarks which have how you can register for the Life Registry. Okay.
I saw there was a question here.
Oh, yeah. No, I have to stand here. Whatever. Okay. I can be loud as it is. I had a question for Dr. Geldof. You mentioned about caring and depression, which that's pretty exciting. I'm saying it's a different thing. Maybe for me, it was the first time to hear. But because of that, I had some questions. One was, how does one detect that caring is leading to or is causing depression? Can I just ask all my questions? Okay. Yeah. Second is, can it happen that, in fact, if detected, it would in fact lead to more caring, trying to overcome that depression, thinking that that's the way of overcoming depression? And third, if, let's say, caring is taken off, assuming it's leading to that, would there be a rebound phenomenon or something and some unwanted outcomes after, like, from the person who's depressed? Am I making some sense?
Sure, yeah.
Yeah, okay,
So,
thank you.
So these are great questions, thank you. And I'm going to first off say I don't know, because we just found this, we just confirmed the finding. You know, we had accidentally found it in 2 different data sets and decided to go look for it. And sure enough, it manifested in a 3rd independent data set. So it's something that we need to be exploring more detailed scientifically. Anecdotally, I can think, though, that so you asked, how do you detect it? Well, number one, it's I think people know each other well enough to be able to basically be able to speak up and say, you need to take care of yourself, right? Caring, as we oftentimes define it, is caring for others. And what I think that we're missing is that you also have to care for yourself. And sometimes what that means is making sacrifices. You know, I was talking to my wife the other day, and she said, John, you need to take a break. I said, yeah, but I want to go do this and this and this, you know, because playing with my kids is a top priority. Spending time with my wife is a top priority. Getting my work done is a top priority. Taking care of myself is important, but it's not a top priority. And I was always working toward my top priority and never working toward my lower priority. So I was never taking the time to just be, I wasn't taking enough me time, basically. So I think that talking to others and being willing to speak up and tell others that, hey, you know what, you need to take some me time, you need to kind of let this one go, would probably be the best approach to both either detecting it and hopefully stemming off this idea that once it's detected, how do you keep yourself from spiraling into this? Well, I'm going to care more, and I'm going to care more. It's realizing, yeah, you should care more about you. Does that hopefully answer the question, or sort of? Okay.
You could also look at it from a different causal directionality, that people who have pain may be more compassionate towards other people who have pain. But the problem of not setting boundaries, right? Not saying, yes, it's terribly sad that this has happened to X, but not getting absorbed by it, not getting attached by it, being caring and compassionate, but being good at setting boundaries. And I think folks who are very depressed aren't good at setting those sorts of boundaries, and they don't take care of themselves very well.
We heard a lot about depression. How about anxiety? Can someone have anxiety without depression?
They overlap like 70%. So, yeah, you can have anxiety without depression, but most often they're comorbid, at least clinical cases of anxiety and depression. But yes, you can have anxiety without depression, but one puts you at risk for t'other.
It's also fair to say that the treatments for both are similar, because as has been said there, they don't exist in their pure form except rarely. And antidepressants also have an impact on anxiety disorders in that way.
And depression, in fact, is comorbid with a lot of other mental disorders, not just anxiety, but even bipolar disorder, schizophrenic. Not probably schizophrenic patients die before they, really old others, but yeah. So it's just intertwined. It's so with a lot of other mental conditions.
Let me just say, I think there's a lot of nihilism around schizophrenia, but actually research has been showing that maybe as close as half people by later life are doing pretty well who had been, as a young adult, diagnosed with schizophrenia.
Coming back to the anxiety and depression, I want to also make sure that we differentiate between diagnoses of chronic anxiety, chronic depression, and individual instances of those two things. Just because you have an anxiety diagnosis doesn't mean you're always having panic attacks. Just because you have been depressed doesn't mean you currently are. So although at a chronic level, you're right, there are definitely correlations and probably underlying factors that cause both of these things. It is possible to have an episode of, let's say, an anxiety attack without currently being depressed, or feeling depressed without going through the anxiety at the same time.
My question is to Dr. Batty. Now, in the graph that we described, where the mortality goes down initially and then goes back up, so some level of depression seems to be protective in that situation.
That's not my memory, no. So it was stepwise. So an increase in, you can say depression is associated with an increase in mortality, and it was across the full range. So low levels were associated with an increase, and higher levels were associated with a higher risk of mortality. So there wasn't any kind of threshold, as I remember that graph.
Thank you.
You do see these non-stepwise relationships, if I can put it that way, for other outcomes. So we've done other work with other endpoints. I'm just trying to think. So, for instance, you see in relation to intelligence in relation to bipolar disorder, you see bipolar disorder is when the highs are very high and the lows are very low. So it's not a constant mood state. You tend to see in folk who do very well on intelligence scales, and those that don't do very well, you tend to see high rates in both, and then the lowest rates in the people with average cognition scores, but not in the context of mental health and mortality, as far as I'm aware.
I do remember the slide that he was talking about. There was a dip, but I think what it was that there's a larger standard error there, so there's probably less information, meaning that I think that David's interpretation is right, although if you just looked at it, you might be mistaken thinking that there was a dip.
So I take your point, yes. So thanks, John. There was a dip in the middle. I guess if I was to put a line of best fit on that, it would be not quite a 45-degree angle, but it would definitely be upwards. Yeah. Sorry, I misunderstood. Thank you.
Hearing terms like detaching and compassion, self-compassion, makes me think of Buddhist beliefs, which begs the question of the role of spirituality in mental health. Maybe you could speak to that.
Right. Yeah, it does. But Kurnow came up with those four things when he actually looked at all the world's major religions and found that they occurred in Buddhism and Islam and Christianity as well, and Taoism. But spirituality can be a really powerful buffer against stress. We know that older adults are much more likely to attend church. They're much more likely to pray when they have problems. And that tends to help. Now, sometimes there are different forms of spirituality, and I don't want to say, that it's uniformly positive. If you belong to a very authoritarian religious group where there's a lot of blame and threatened with hellfire and brimstone and things like that, that's actually associated with worse outcomes. And if you lose your faith, if you think that the problems that you had are because God has abandoned you, and you went to church every week, and you prayed, and you still got breast cancer, right? That's also associated with higher mortality. So it's more complicated than an unalloyed spirituality is good for you. It depends on the type of spirituality. It depends upon what you do with it. And it depends upon how it affects your relationships with others.
Can I add to that? I think that's a really interesting question because spirituality in health economics literature, it is termed as spiritual capital, which is, interrupt with the social capital. It's like, person's connectedness to people around the person. And spirituality or spiritual capital or social capital are so intertwined. So oftentimes it's hard to tell, whether it's because of spirituality or either because of social capital. So the literature really doesn't, tell us the answer yet. But, the relationship is complex, and, we need to consider, whenever we talk about spirituality, we also need to consider, social capital. So.
It is a protective factor in later life for mental health. Yeah.
And it has been looked at in the context of suicide research, so particularly in the context of social isolation. So studies have tried to come up with indexes where they look at contact with other people via maybe a significant other, maybe contact with sports clubs, it may be attendance at religious services, and all those indices show a protective effect against suicide. Just to round off that particular point. Maybe.
I was just curious, and it wasn't any of your presentations, so I hope it's okay to ask this, but we were talking a lot about social isolation and being with people and in social groups. I'm wondering, both for young people, but especially for older people, do pets have much of a benefit for mental health, staving off depression, various things like that?
So we did some work on pet ownership and animal companionship a while ago, and I remember presenting it to a bunch of colleagues who many of whom were pet owners, and they were really disappointed with the result that we didn't find an association between animal companionship and pet ownership and the occurrence of depression. The literature is fairly mixed.
I've seen some literature that does seem to show it, so I don't know. I think,
Well,
I think it's still an empirical.
I did cover myself by saying it was mixed.
Yes, you did. But the question is, what would the mechanism be? Would it be,
Right.
because there's so many different ones that you could imagine, right? Yeah.
Well, exercise is one. If you're walking your dog,
Yeah,
you get
and-
more exercise. There's lots of good studies that show that.
Yeah.
And the other thing is that you can show that a lot of people make social contact through their animals. I met actually most of my neighbors through taking my dog to our local dog park, right? So there are positive mechanisms that are possible that don't always show up in large epidemiological studies.
Also, the sense of having a reason to get up in the morning, meaning if you're living by yourself and you don't have to go to work and you really don't have to do anything, but if you have to take care of an animal, that can be quite helpful.
Right.
It's probably also worth pointing out that it can have a reverse effect as well when
Right.
distress in an animal, so illness, loss of an animal, there's some evidence that can cause distress to the owner and also lead the owner to fail to look after themselves in probably ways that they maybe should.
Right.
Just bring a bit of balance that to the
Yeah.
pet advocates up here.
Yeah.
Yeah, on the other end of the lifespan, though, among young youth, let's say, there is definitely some skill building that goes on. I have a colleague, Megan Kylie Mueller, at the Tufts Vet School, and she's kind of a rare social scientist at a vet school and does a lot of work on human-animal interaction, animal-assisted interventions. We're doing some work at the Green Chimney School in New York. That's it's a farm school that's centered on multi-morbid children and using animals as a conduit through which they can learn skills and kind of learn to interact in ways that maybe they can't learn in a normal classroom setting.
I think looking at pet ownership and animal companionship is an interesting one because the sense for most people, including myself, is that it's life-enhancing being around animals and whatnot. It's one of those examples where the evidence doesn't always support that, I think.
But you do have more daily hassles, maybe.
Especially with old and ill animals.
We have time for at least one, if not two more questions.
If anybody has question about serious policy question, I'm here.
So I'm with Crop and Soil Science, retired 18 years. But as many of you may know, OSU has taken on the role of the Global Hemp Initiative Center. And I realize this, I just want your reaction as to we had 62,000 acres this year in Oregon where we're producing probably primarily 80% of it will be for CBD oil, which has some connection to that it may help the anxiety, depression, or whatever. Do you mind responding to that? You know, I'm actually on the outside looking in, but I know many people that are working with it. Obviously, people are asking me questions, and I just don't know what to say. There's so much confusion out there, and I guess it is a part of the mental health issue, though.
I would just say that there's going to be more research ongoing. I don't think we have a good database to answer yet, but I will say there's a great database on the placebo effect. So if you think it's helping, maybe it will help. And it's also, I don't know that there would be too many negative side effects, at least to the cream, but actually I don't know for sure, but it seems like it would be fairly benign. So why not try it?
It depends on how much THC. So you can get the CBD that has no THC in it.
Oh, that's what I thought you were
versus-
talking, are you talking about with THC or just CBD?
The CBD oil, it
Right.
has to be less than 0.3%.
Right.
That's what I
Oh,
thought you were
yeah,
talking about,
I
yeah.
didn't explain that. So, yeah.
Yeah.
Only the one that's legal, so to speak.
There is some social psychological studies, are some studies that show reduced performance anxiety after being administered a dose of CBD. The confounding factor is that the dosages that they've been using in those studies, which are quite old now, were much higher than the doses that people seem to be taking. You know, we're talking about multiple milligrams, you know, maybe even, 15, 20 milligrams in these studies, whereas I think that the dosage people are trying to pick up anecdotally, especially, like here in Oregon, are much lower than that. And I don't know of any research that actually has plotted out a dose response curve or has really established, is there a consistent effect and at what level does that effect manifest?
Right, and part of the problem is that, the studies that we have are very small-scale studies because you can't get federal money to study this, because it's still sort of classified under marijuana, which is considered a class 1 drug. And it's very, we need really good population studies. And just relying on self-report, the early studies out of Oregon suggested that with an increased use of CBD, there was a decrease in opioids. So they said, yeah, right? But then they kept following people, and now they're saying, no, actually, there's now an increase in opioids. So, we need a lot better data. We need federal support to collect the data in some ways for some of these medications. And my guess is that you're going to get, with any such thing, you'll get a whole bunch of studies that say, this is wonderful for you, and then you'll get a whole bunch of studies saying, nah, it doesn't work, or it's bad for you. And the answer is probably somewhere in the middle with a lot of individual differences.
So this has been a span of life discussion. I'm wondering if there's any interesting studies out there that connect older adults with youth, and if there's any mutually beneficial interactions from a mental health perspective.
Great question. Intergenerational programs, I think there's good data to show that they can be quite helpful. I don't know about directly on mental health, but certainly in terms of, I'm thinking, for example, what's the name of it? The Baltimore Experience Corps study, where they took, these were mostly older African-American women, were going into school systems in the Baltimore area, and it's now been scaled up to many cities across the U.S., and spending significant amounts of time with kids, helping them with literacy and all sorts of things. And actually their cognition got better, their physical health got better, so one would only guess that if they were measuring any kind of depressive symptoms or mental health, one would guess that they got better too, although I don't know off the top of my head that I can definitely say that. But yeah, this is, I think, I think we really need to be doing much more in this area. I just recently got a small grant to look at coming up with better measures for intergenerational contact, because I do think it's very important.
Yeah. And my favorite is that there's a lot of daycare centers for kids that are pairing with adult daycare centers. And I have a former student who studies these, and she says that the best person to take care of a 3-year-old or a 2-year-old is someone with mild cognitive impairment, because they don't mind repeating the same story over and over and over and over again. But we need more data. Everybody's sort of saying this is a good thing, but there aren't as many studies. I mean, there's studies on volunteers showing that volunteering improves physical and mental health, but not so much in the intergenerational literature. There's some.
There are some, yeah.
Yeah.
I'm involved with a co-housing group, and we were talking about a lot of the issues of social isolation and how having a cohort, which we don't have as many, but I think there's a lot of studies in Denmark and places, and it's so supportive, and there's a lot of them that have the intergenerational effect that is wonderful. So I'm hoping to learn more and see more about the co-housing, which counters a lot of the negativity of becoming older and isolated.
Is this in Corvallis?
Yes.
Is it the South Corvallis co-housing project?
No, it's a group that was trying to put one together, but their land got pulled. But, so yes, there is a co-housing, and they're more intergenerational. The one that I'm learning from is they're trying to do seniors. I'm trying to do one for low-income women. It depends a lot on the properties, and the zoning is really critical. So I'm just learning about
Let me tell you about a wonderful model. Now, I'd love to see if Corvallis could get this eventually, but Bridge Meadows up in the Portland area, and they've got several now where they're putting together people who are older, low income, with foster parents and children housed in the same place, and the older adults have to agree to spend, I think, it's maybe 15 hours a week, maybe less, but significant amount of time with the kids, which is very helpful for the foster parents, very helpful for the kids, and very helpful for the older adults. It seems like a win-win-win, and it's been very, very successful, at least anecdotally. I don't know if we have hard data yet on that kind of project, but I think it's promising. Okay, I think we're at 5 o'clock, a little bit after, so thank you so much. And if anybody has additional questions of any of us, I'm sure as we're gathering up and going out, we'd be happy to talk with you or give you our email. Thank you.
Thank you.